Complex regional pain syndrome. It doesn't sound like something anyone would want to have to deal with. It's also called CRPS. This chronic pain condition can wreak havoc on your body. Dr. Rudy Gari from Florida Pain Relief Group joins us now to fill us in on what this is. Great to have you back.
Thank you.
Complex regional pain syndrome sounds awful. What is it?
Yes, it does. And the reason why it's called complex regional pain syndrome is because it's just that. It's complex. This is something that's been going on, Cindy, for a very long time. In fact, this goes all the way back in the Civil War. We have documented case studies of soldiers that actually had so much pain in their arm that they wanted to cut their arms off.
Ooh, okay.
It used to be called something called causalgia. It was called reflex sympathetic dystrophy. The term that's used right now is called complex regional pain syndrome. And what that really is, if you think about it, think about if you get pain in your hand or your arms anywhere, normally that pain shoots up to your brain and it stops.
Right.
You got pain there. What happens with complex regional pain syndrome is that it becomes a vicious cycle. So the pain keeps going in circles, and it never stops.
Any particular area of the body that you see it most often?
It usually affects the extremities, it affects the arms, it affects the legs. It can actually spread. But the good thing, Cindy, is there's a lot of things that we can do to help complex regional pain syndrome. One of the first things is that the earlier that we see it, the better. And so it often travels during these nerves called sympathetic nerves. So what we do is what's something called sympathetic blockade. We want to stop that seizure, that pain constantly going in circles. But it's a certain specialized field of medicine. They're usually physicians like myself. I'm an anesthesiologist. I've been treating this for many, many years, and I've actually had great success. So there's blocks, there's different something called spinal cord stimulators, and the earlier that we treat this, the better it is for our patients.
How often do you see somebody coming in with this complex regional pain syndrome?
I just saw a patient this morning.
Really?
This patient has horrendous leg pain. And there's all kinds of issues going on, not just nerve pain. It affects your vascular system, and the pain is never ending. She has, unfortunately, had this for many, many years.
Oh, gosh.
Yeah.
Well, she doesn't have to live with it for any more years, right?
No. We have
What are you able
to
do for her? What are you going to do?
So what we do is we can give her some medications topically to help with that pain. We're going to go after to try to stop that seizure, if you will, of that pain syndrome. Blocks, and we're considering a spinal cord stimulator as well.
So get to the source, right?
Absolutely.
Instead of just
Absolutely.
Treating.
It can be cured.
It can?
It can be cured, yes.
Okay, so when is it time for someone to come see you, when they feel like this is something that's been going on with them?
The sooner the better.
Yeah.
The sooner the better. Have seen someone like myself, because we can treat you, and there's things that we can do. So
usually fingers, legs?
Fingers, arms. It's usually either the arms or hands or legs.
Okay.
It usually begins with something as mild as just bumping into the wall somewhere can cause that like a seizure to just continue, where we have to put a stop and stop that vicious cycle.
It keeps going on and on.
Yeah.
Okay, good stuff. Dr. Gari, that's really good news for so many people. Florida Pain Relief Group has schedules same-day appointments, so be sure to visit their website. It is floridapainreliefgroup.com, or you can give them a call at 844-KICK-PAIN. Doctor, always good to see you. Thank you very much.
My pleasure.
We'll be right back.
Thank you.